Good morning, good afternoon, good evening, depends on where you are. I am Alina Naraki from Dental Arts San Diego. Today we are going to show you the process of single implant placement to replace a single missing tooth. This is the back of the mouth. Just to give you the visual, this is the upper jaw on the right side. And what I'm doing right now is I'm flapping the gum so that I can open up the axis and visualize the underlying bony structure better. We're starting on the next step of the implant placement, which is preparing the site for the actual diameter of the implant that we picked for the patient. So I'm going to go through a sequence of drills starting from the smallest one all the way to the diameter corresponding with the diameter of the implant. In this particular situation, I picked a 5mm implant as it can restore the back of the mouth or the chewing teeth called molars much better, and they're the strongest one. Looks like I'm on my last drill right now. And after this, what you see is the actual implant placement or torquing it inside of the bone. This process is very slow and precise, and it allows me to feel how dense the bone is going to be. So if the bone is very dense and allows for the one stage of surgery, I will go for that, which means we would put the healing abutment, and then say like in 6 weeks or 3 to 6 weeks, we will follow up with the crown. In this particular situation, that didn't happen. The patient had not that dense of a bone, so I decided to give a little bit more healing time. So I'm going through the two-stage procedure, which means I am removing this driver, the top portion of the implant that allows me to just correctly angulate the implant in the jaw. And then I'm washing and keeping everything nice and clean so that there is no foreign particles inside of that implant. And then what I'm going to do is I will close this axis with what is called as a healing screw. This is that green particle that just went in. And after this, I will suture the gums. Once this is done, the patient will come back next week. We'll remove the sutures. And then about 3 to 4 months, depends on the age of the patient, on the gender and supporting health history, we will start on restoration. And most of the time, we actually don't have to go through the two-step procedure. So now it looks like I'm checking to make sure everything is good and suturing. Sometimes we just keep all this last step all together. If the bone is very dense, there is no reason to do this, and we can start a restoration much sooner.